Do you have high blood pressure? If you do, you need to pay attention. It's Dr. Erica Jones here. I'm a board certified family medicine physician, and I'm talking to people right now at this moment who have high blood pressure. If you have high blood pressure, these are three things that you need to make sure that you don't do. The first thing might seem like, it's a little known already, but here it is. The first thing you should not do when you have high blood pressure is ignore it. There's a reason why they call hypertension or high blood pressure the silent killer. It's because oftentimes people can live and not even realize that they have high blood pressure. Now, you'll encounter some people who will say, oh, well, yeah, I did have this headache and I just thought it was a migraine or something like that. But it's important to understand that your blood pressure has to be controlled, or it can lead to things like stroke or heart attack or even kidney failure. So please do not ignore your high blood pressure. Don't think that it's just going to go away. You have to take action. Number 2, if you have high blood pressure, you've got to make sure that you do not continue to hurt your own self by continuing unhealthy lifestyle habits. And that means like eating certain foods that have a high salt content. That means like smoking. You cannot continue to eat those type of foods. You cannot continue to smoke. You cannot continue to avoid exercise when you have high blood pressure. If you have high blood pressure, it's important to make sure that you are practicing a healthy lifestyle. And I know it can be hard to eat right. I know it can be hard sometimes to exercise, but if you put your mind and your body to it, you can definitely do it, okay? Now, here's another thing that I want you to make sure that you don't do if you have high blood pressure. Please don't stop taking your medicine if you haven't consulted with your healthcare provider. Oftentimes, I've encountered patients where they say, Doc, I just want to get off this medicine. I don't want to be on this blood pressure medicine anymore. It's making me feel, X, Y, and Z. However you feel like your medication is making you feel, it's important to communicate that with your healthcare provider. Don't just stop taking your medication without communicating with your healthcare provider. There are so many different ways these days that you have to access your primary care physician. And hopefully, you can call in and leave them a message and say, hey, doc, I don't like the way this medicine is making me feel. I would like to stop it. I would like to taper it. And we can offer other options for you. But please, no matter what you do not just stop taking your medication without talking to your healthcare provider. I am Dr. Erica R. Jones. I'm a board certified family medicine physician, and I just gave you 3 things that you make sure that you don't do if you have high blood pressure. Please do not ignore your high blood pressure. Do not continue unhealthy lifestyle habits, and do not stop taking your medication without consulting your healthcare provider. Thank you. If you learned something from this, if you thought it was a good tip, please make sure that you like, comment, and if you're not subscribed already, subscribe to my YouTube. It's Dr. Erica Jones here. Thank you.